Dr. Ishaan Madhok from Borland Groover joins us this morning. How are you?
Good. Thank you for having me here today, Christine.
Thank you. So I really don't want to say it's part of the signs of getting old, but let's just say it's part of the signs of getting wiser. The need to get colonoscopies in the United States and everywhere.
Yes, and it's an important need, and it's something that's, we're actually addressing earlier. I wouldn't even say the age 45 is old, and that's the age where,
You're
we're
just getting
recommending
started.
screening. Yeah, you're just getting started. You just kind of maybe got married, have kids, have a career going, maybe switching careers, but a lot of exciting things that are happening in life around age 40, 45, and that's really when you start thinking about getting your first screening colonoscopy, or at least discussing colon cancer screening with your doctor.
I'm assuming it's a really good thing that we're talking about this now because I don't remember my mom or grandma talking about colonoscopies.
It is, and you're right. You're absolutely right. We're finding that colon cancer is increasing as well as other cancers are, but they're increasing in number in terms of how early people are getting them. But however, colon cancer has now become the leading cause of death of cancer-related deaths in patients under the age of 50. About 20 years ago, it was about number 5, and so it's certainly increasing in terms of the prevalence, but also younger people are just getting colon cancer.
Is it safe to say that most colon cancer is preventable, or most colon cancer deaths are preventable?
It is. When colon cancer is detected at an early stage, it has a good prognosis. Over 90% of people, end up living. And so there are a fair amount of colon cancers that are preventable. And that's really, when you discuss with your doctor, choosing the right screening tests, one offers the additional benefit of prevention as well as early screening, and the other, which may be the stool-based tests, offer just kind of the screening part. And what I'm talking about in prevention is colonoscopies.
So you had said that it is the number one cancer-related death in adults 50 years and younger, but that the first tests should happen around the age of 45. Why is that? Are we seeing deaths younger than 45, or a lot of deaths younger than 45?
We are certainly seeing deaths, younger than 45. When it comes to, sort of population statistics, there are all these, analysts and health experts that kind of make, decisions based on, costs and benefits. But in general, over half of colon cancers that are diagnosed under the age of 50 are between the ages of 45 and 50. And so that's kind of the reason for why 45 has become the age. But I suspect if we're not able to identify, why people are getting colon cancer younger, and we're seeing this continued increase, I think the age will continue to drop. And that's just for average risk people. There are people that are at increased risk for colon cancer, such as those that have a family history of colon cancer or advanced adenomas, which are kind of the big, scary precancerous polyps.
That's an adenoma, you called it?
An adenoma, yep. And then also if they have underlying, other GI-related conditions such as Crohn's disease or ulcerative colitis, that may put them at a higher risk for colon cancer. They're being screened even earlier than 45.
So you had mentioned that we're not exactly certain why people are getting cancer earlier, but that is a statistic, that people are getting cancer younger and younger.
That's correct. Yeah, and we have some theories and some ideas. Nothing that we're absolutely sure of, but some potential theories that are out there is that we have some alterations in our gut microbiome, the bacteria live in our gut, whether it be from environmental exposures or even processed foods leading to pro-inflammatory states that may increase the risk of cancer. And then obesity has been, linked to multiple different types of cancers, including colon cancer as well. And those are all things that are, sort of more prevalent in our society than they were maybe 20, 30 years ago.
So lots of studies happening right now, lots of things that are theory. As a doctor who is in this field of practice, what do you normally eat for breakfast?
Well, to be honest with you, I don't eat breakfast very often. And that's probably
by design or
something,
because of time?
It's usually more time, to be honest with you. And I try to eat an earlier lunch. But, I think in general, what your meals should strive for is tending to have more whole foods, fresh foods and fresh fruits and vegetables. Things that come in packages tend to be processed, high in sodium. Having a well-balanced diet, I think kind of the popular diet for most people that's kind of been proposed by a lot of healthcare, whether they're influencers or doctors or experts, and I think people agree on is a Mediterranean-style diet. Less red meats, more grilled meats if you're going to have meat, fresh fruits and vegetables, whole grains, things like that.
Are there any foods and I understand that you're not going to promote or talk badly about any particular brand name of food, but are there any food items that when you are shopping at the grocery store, you refuse to buy?
I used to have a big weakness for Oreos, and that's a cookie I've always loved, and I've given those up. It's not something that, it's just more about watching your calories, again, watching processed foods, trying to stick more to the greens and vegetables. It's nothing against Oreos. I love them, but, that's just kind of, I think the mentality I go into is really, what can I sort of look at and feel, and what looks like, it's gonna be good for me and nurture me. Our bodies have to last us a long time, and we want to take care of them.
So to that end, what are some of the symptoms of colon cancer? Are there any that we would feel? So, for example, somebody had told me, well, if you eat something bad and you feel something bad afterward, chances are it's probably doing something bad to your body. Are there physical symptoms that we can feel from colon cancer, or is it silent?
There are physical symptoms that we can feel, but most of the time, when we talk about colon cancer screening, we want to emphasize that screening refers to patients and people that aren't experiencing any symptoms. And oftentimes when you do experience symptoms from cancers, it's often too late, or not too late, but it's at a more advanced stage where perhaps it's not as easily treatable or even curable. And so, but that being said, you certainly want to look for signs that may indicate that something is going on inside your GI tract. So, eating is a big part of our lives. We do it socially, we do it, just independently. It's something that we do no matter what. And so we tend to have I think overall, we tend to be focused on our digestive systems, count our bowel movements, look at that type of thing. So I would pay attention for any major changes in the absence of any significant external factors, such as, changes in diet. So if you notice that all of a sudden, you tend to be more constipated or backed up, or you tend to have more diarrhea, blood in your stool is certainly a red flag symptom, is what I would say, and that should be a reason why you should go and see a doctor. Hemorrhoids and things that a lot of people tend to have oftentimes are the culprit of this, but, you don't really know until you have someone check you out, so don't brush it to the side. Additionally, other symptoms you might feel are fatigue and just kind of non-specific things like that. Fatigue may indicate that you're anemic. Anemic meaning that you have some low blood levels, and that can happen from colon cancer, where you may not necessarily see bleeding, but you have low blood levels due to some intermittent oozing that happens. So fatigue could be one, unintentional weight loss, any significant appetite changes, pain, certainly.
Do you tell people to come to see you if they just know something is off about their body? Is that usually a generally good indicator? Because we know our bodies, right? Sometimes we can't tell our doctor, hey, it's this, this, and this, but I just feel like something's off.
Yeah, I think that, oftentimes we, one of the first I think lessons in medical school is, you kind of learn how to interview people sort of like you're doing, and so you want to really ask in-depth questions. And sometimes doctors, like, if I talk to a patient, I ask a question, they'll say, I never thought about that. But yeah, now you mentioned that it is. And sometimes it just takes someone interviewing you to sort of bring out and maybe further characterize what you're experiencing, and someone that has expertise that can kind of, guide you and sort of focus those questions and channel that to maybe addressing your underlying issues or symptoms that you're experiencing.
My guest is Dr. Ishaan Madhok with Borland Groover, and we're talking about colonoscopies and colon health. You had mentioned changes in bowels. This is not a time to be shy, right? If you notice that your poo is changing colors, you need to tell your doctor, or it's changing consistency. You need to tell your doctor and not be embarrassed about it.
Absolutely. This is our job here. We do it every single day for many, many hours. We study a long time to be able to do this, from everyone from our nurses to our techs to our front office staff. Everyone is very, very familiar and comfortable and open, talking about this. So, Borland Groover really try to make our patients feel comfortable, greet them with a smile. I think we're consistently one of the best places just for staff to work and employee satisfaction, and that shows, and that makes people feel more comfortable. And so we encourage, everything. People, sometimes I've had patients show me pictures of their poop on their phone and, see, this is what it looks like. Is this normal? And so, we encourage you. This is certainly not the place to be bashful. Please, tell us everything, and we were here to help you.
So this is a good time to bring your phone into the bathroom if you suspect a problem. My grandfather, Pop, he has passed, so he won't mind me saying this, but he used to keep a journal alongside the toilet that indicated color, shape, size, consistency. And we all used to make fun of him. But that is a really good barometer of your health, right? I'm not suggesting that everyone keeps a journal by their toilet because that is kind of gross.
On TV, they called that the Sheldon Cooper.
Did Sheldon do that?
Yeah.
So they're onto something, though, right? I mean,
Yeah.
you need to look before you flush.
Right. I would advise that.
Did
look
you know
before
that you would be
flush.
talking about poo as much as you are this morning?
Yeah. No.
But
it's
look
good, yeah.
and take pictures if you need to before you
Absolutely.
flush. And don't be ashamed to show your doctor those pictures because y'all have seen it all.
Right. Absolutely.
And when you ask questions about somebody, those are among the questions that you will ask, right?
Mm-hmm. That's correct. Any changes, frequency, how often are you going? What did you used to go, like, let's say 3 months ago? Because maybe you've been having symptoms now for a couple of months and it's kind of, worn off. We've gotten used to it. But then if you ask, what were things like a year ago or 6 months ago? And you say, things actually were different. Those could be signs, yeah. Any changes?
So this segment is not sponsored by anybody, and I certainly am not endorsing anybody, but I did have a colonoscopy at Borland Groover, and it was an amazing experience. I think I have said shout out to Dr. Salas because he was amazing and that the whole team was great. However, when I first went for my pre-screening stuff, I didn't know that they were going to ask questions about that. And I think that I was still getting over the shock that someone was asking detailed questions about my poo before I was even able to honestly talk about it. So I guess one of the things that I want to make certain that our listeners know is that when you're at the stage and when you need to do it, get over that shock before you enter the doctor's office because they're going to ask and they want to know.
Absolutely. And I think the poop emoji that's come up on the phones has been a great kind of barrier breakdown for us to talk about it more. So
okay, that's great. So you had mentioned earlier as well polyps and the significance of knowing if family members have polyps. So in addition to talking about your poo, is it important that family members talk about polyps? Hey, I had a colonoscopy and I had polyps. So
that's a great question. I'm glad you asked that because that's actually, I think, one of the most challenging, questions that we ask because, you may have heard that, oh yeah, mom or dad had colonoscopy, had polyps, told back to come back in a few years. But what actually also matters is not only the presence of polyps, but the types of polyps. I think sometimes as doctors, we don't do a good enough job of, telling patients exactly what kind of polyps that they have because certain polyps may be more precancerous than others. Those are the advanced adenomas that we're talking about. That refers to the cell type, the histology, when the pathologist looks at it under a microscope, as well as the size, greater than 1 centimeter. So I would even expand saying that, ask your parents if their polyps were big polyps, or your family members were they big polyps or small polyps, or, those can all be helpful in terms of determining, what your risk is, but also what test is appropriate for you. We have different types of colon cancer screening tests out there. The two most popular ones are stool-based testing, such as Cologuard and colonoscopy. Cologuard isn't indicated for patients that have family members of colon cancer. That's one part. But the other part of that is also for patients that have family members with advanced adenomas, the big, scary polyps. And so knowing what type of polyps that your family members have is definitely very beneficial.
Okay, so the next family gathering, we're all going to talk about polyps. And is that something that a doctor will say? The doctor will say, hey, you had big polyps?
Yeah, so my first... whenever I finished a colonoscopy and I talk to the patients right after, when they're woken up and they've had their apple juice and I go over the report in detail.
I didn't get apple juice.
There you go. You didn't get apple juice? What was
I did
your
not
drink?
get apple juice. It's okay.
Okay. So we have apple juice here at our center and, I go over the report line by line and I say, do you have any children? If a big polyp, they have a big polyp. So do you have any children or any brothers or sisters? And they'll say, oh yeah, I have, whatever, so-and-so or no. And then I tell them, make sure that you try to, you communicate that you had these findings and that they need a colonoscopy if they're at this age, when. So I do try to tell my patients when I find a big polyp that they need to let their family members know and give them exact age of when they should have their colon cancer screening.
So any polyps or just big polyps?
It's helpful to know. It really just depends on the type of polyps and then big polyps in terms of size. Those are the ones that are probably I see more commonly where they affect the age of screening. But there are certain types of polyps as well. But I would kind of, to avoid generalization of that type, I would just say, really ask your, if you're unsure if your family member what type of polyps they have them ask their doctor or at least have your doctor. You can always ask your doctor to get to advise you on when your next colonoscopy should be.
You all are going to curse me because now every patient is going to start asking all kinds of questions about their polyps. And you're going to be like, this is adding 3, 4, 5 minutes to each procedure. When you find polyps, first of all, are polyps common?
Polyps are very common. There are different types. There's benign types, which are non-cancerous, or some that we put into the category of precancerous. There's some that don't have any sort of cancerous potential, if you will.
So how common? Like how many, what percentage of people, and I know that I haven't asked you this ahead of time, but about how many, more than half of people come in with polyps?
I would say it's usually less than half of people that have the precancerous polyps. We just don't know which half, like who's going to get them. It's not just, family history can play a part, but it's not just family history. We see a lot of patients that have no family history and just happen to have, every time we do a colonoscopy, they have a polyp that happens to be precancerous,
And we don't know what causes the polyps, correct?
We don't know. But what we do know is that most colon cancers, most of them tend to start off as polyps. And those polyps, think of them as like little growths. Polyp really just describes the shape of tissue. And these are little growths on the inside of your colon. And as they get bigger and as time goes on, they can turn into cancer. And so if we know that, obesity, increase in processed foods, and we have all those other associations with an increase in cancer, I think it's probably safe to say that that polyp is part of that pathway, that there's something going on with those factors as well that contribute to polyps.
Prevent the polyp pathway. This broadcast is a test in how many times we can say polyps in the span of 30 minutes. So when you find a polyp during a colonoscopy, do you take it out?
Yes, that's our goal. Our goal is to take out every single polyp that we find.
And what does that entail? Right? Are you like scraping it, cutting it?
Yeah. So it really just
We're
depends.
Getting down and dirty.
It depends on, a couple different factors. Number one is the size of the polyp. We have our colonoscopy. It's the scope that we use is about this width of a pinky, but it's got a channel there where you can kind of insert tools. So while your endoscopist and your gastroenterologist is looking through your colon, they're looking to see polyps, and they take pictures. They have a camera and a light at the end of the scope, and if they see a polyp, they may choose many different ways, or even multiple different ways to take out that polyp. It could involve using small little forceps to remove it. We have a snare as well that kind of, you wrap the snare around the base of the polyp and it just kind of cuts through the tissue. There's sometimes some more advanced techniques if they're bigger polyps that require, separation from the underlying tissue to allow to get the polyp all out in one piece. And sometimes we just have to kind of hack away at it with different tools, a combination of those. So different ways to get out polyps.
Is it painful?
It should not be painful.
The person's asleep.
Yeah, the person's asleep. The colon really doesn't have the same types of burning and pain receptors that the rest of your body have. So even though we're kind of hacking on the inside and removing these polyps, you shouldn't feel any pain. Of course,
you're carefully hacking, right? You're not just hacking away.
Absolutely, very
right.
carefully. We take our patient's health very seriously. The risk of complications from a colonoscopy related to removing polyps are pretty low.
And the risk associated with not having a colonoscopy much higher than the risks associated with having a polyp
Absolutely,
removed.
for most people, especially if their average health. So yeah.
My guest is Dr. Ishaan Madhok with Borland Groover, and we are talking about colonoscopies and the preventable deaths from colon cancer. So, Dr. Madhok, there are a couple of different kinds of tests, screening tests for colon cancer. What are those?
Yes. So the two main screening tests that we'll see is stool-based tests, often mail-in, and then colonoscopy. So there are differences between the two. Colonoscopy is kind of considered the gold standard. It's a procedure. It's minimally invasive. It's low risk. It requires some sedation, but overall, low risk. The advantage of the colonoscopy is that it gives your doctor direct visualization of the inside of your intestines and the ability to detect cancer at an early stage before it causes any symptoms, take biopsies, lead to early treatment and higher success as a cure. But more importantly, and I think what we see more often is that we're able to detect polyps and remove them at the same time during the colonoscopy. And what we found is that most colon cancers start off as polyps. And so by doing the colonoscopy, we're able to screen and detect cancer at early stages before it causes symptoms, but also prevent colon cancer by removing polyps and then sort of risk stratifying you when your next colonoscopy should be based on those type of polyps. That's based on type of polyp, size of polyp, number of polyps. On the other hand, you have the non-invasive tests, which are convenient, right? There's often tests that you don't have to have someone take you to the procedure. You're not getting sedation. There's no risk of possible procedure, but they do come with a lot of drawbacks. And I think as my job as a doctor is to really go over all the information and statistics with my patients and give them everything in an easy to understand way where they can make the best decision for themselves. And so I think it's important to understand the drawbacks, limitations of each type of test, and so they can make their decision. So the drawbacks, limitations of the stool-based test that you mail in is that number one is that there's a fairly
is that you
high,
have to mail in your poop.
You have to mail in your poop. That's absolutely number one. Number two is that there's a fairly high false positive rate with these tests, meaning that if the test is positive, there's a good chance that there's no cancer. In fact, over 90% of the time, there's no cancer when it's positive. There may be polyps or hemorrhoids or things like that causing these false positives, but there really isn't any cancer. So, and once you get that positive test, there's a lot of anxiety. Your colonoscopy then becomes diagnostic, which may have cost implications, for you, as opposed to a screening test, which may be covered more so by your insurance.
So I don't mean to sway the jury, but from what you've described, a colonoscopy seems like the better choice. Why would anyone want to do a mail-in test?
Yeah, so I think there's a couple of reasons. So number one is some patients may have really terrible, heart disease, lung disease, a lot of issues going on where, they may want to pause and think about, would a colonoscopy and getting some anesthesia medicine, sedation, would it be worthwhile their risk? And that's an important conversation for them to have with all their doctors, whether it's their cardiologist or a lung doctor or the gastroenterologist, a GI doctor doing the procedure. Some patients just have a lot of things going on, medically, and I think they should still be able to make the decision though for themselves and discuss that. But there's a variety of reasons. Like I had a patient who's from another country recently, and she just told me flat out that she doesn't trust American doctors in doing procedures. That was her reason. So
she would rather go for something that's over the counter.
To her home country, yeah. She'd rather go to her home country and get the colonoscopy test done. She wasn't against it. She was just against it in this country for whatever reason, and that's her decision, and that's fine. We respect that. And so she elected to go for for a stool-based test, an alternative test. I encourage patients, whatever you decide, get screened. Whether it's a stool-based test or a colonoscopy, you should do it, as opposed to both are better than not doing it at all.
You had said that there are false positives with the mail-in version. Is there also the possibility of a false negative?
So
what is it measuring for?
The stool-based mail-in test?
Yes.
Yeah. So the stool-based mail-in test, if you were to have a colon cancer, the test is over 90% of the time is going to pick that up, that stool-based test. So it's not going to miss a cancer per se.
Okay.
But there is still a higher rate of false negatives than there is with the colonoscopy.
And then, like you said, then the subsequent testing becomes diagnostic in nature, which may or may not be covered.
Right.
So for the colonoscopy, you had said, I am going to take issue with something that you said. You said it's relatively easy. That's not the exact word that you used. You said that you go mild sedation, once thing. It's not the colonoscopy itself that's the challenge. It is the lead up to the colonoscopy.
That's right.
And I did not know how much fun I was going to have when I was preparing for my colonoscopy. It is a several day long process.
It can be, certainly. And a lot of it also depends on your bowel habits. If you tend to be more constipated, and you may have to do a longer prep. But you're right. You start modifying your diet several days before to have kind of low residue foods. The real fun, I would say, or not lack of fun rather, is the day before, when most people are on a clear liquid diet during that time period. So any liquid that you can see through is a clear liquid diet. And then they start their main portion of their laxatives.
Right, which is a flush of your whole system. And I had told my boss, and Jules, if you're listening, she had a very evil laugh when I said, I'm going to be at work, I'm doing colonoscopy, whatever. And she goes, when is your colonoscopy? And I told her, and she goes, and when are you going to be at work? And I go, I'll be here at the day. And she goes, no, you won't. You will not be at work the day before your colonoscopy. And I was like, yeah, I have a high pain tolerance. It's no problem. She said, you will not be at work the day before your colonoscopy. And I found she was right, because it is a ginormous flush of your whole system. Not painful, just you really have to be close to a bathroom.
That's right.
But there are a couple of different types of preps for colonoscopy. So the one that I had, while my doctor said that was the best one for me, there's another type, at least one other type.
Yeah, there's several types of preps out there.
Do they all involve that big flush?
They all involve the big flush. Yeah, there's no getting around that, and that's really important because part of the colonoscopy is being able to see well, and that means being rid of all sort of solid residue or poop or anything like that. And we actually, as doctors, will grade how good your prep is what we call it for the test.
My prep was amazing, just so you know.
That's great. That's great.
So we should be asking our family members, how are your do you have polyps and how was your prep?
Right, exactly. And so the different types of preps, we have some large volume, big gallon jugs. Those are kind of the older preps, and we still use them. But now we've started to have some more smaller volume preps that have gone on the market. Some of them are powder forms that you mix with liquids. Some of them are already pre-mixed for you. The important thing is that you just follow the prep instructions directly. There are also there's also one pill form of the prep out there as well. It involves having about 24 pills and a lot of liquid with it. So you don't get away from the liquid and the flushing and all of that. But there's certainly different formulations of bowel prep out there.
So what I took were 2 6-ounce bottles of this stuff that I mixed with a big glass of water and drank it a lot. But there are gallon versions?
There's the oldest kind of bowel prep out there, and what you might still find in most hospitals is something called Go Lightly, which is a 4-liter large kind of chalky textured liquid, and it's not pleasant. But for some people, that's the right prep. For instance, if you have renal disease or kidney disease, that's usually the preferred bowel prep for that. And so understanding your medical conditions, certain preps may not be for you.
So are over-the-counter colon cleanses doing essentially the same thing? And do you recommend that for people periodically? Say their, colonoscopy is great. A year from now, should I do a colon cleanse just for that kind of flush out? Because I will say it is not pleasant to go through it, but you feel so good inside after it's done. I don't know if it's ketosis setting in or what is happening, but you do feel healthier after a colonoscopy.
Well, I can't say I would recommend, colon cleanses in the absence of, colonoscopy and bowel prep. But what I will say is that I think constipation is an underlying issue that a lot of us, face related to our lifestyles, diet, getting older, metabolic, derangements, whatever. But the constipation is certainly there. And perhaps if you're feeling better after a colonoscopy, there may be some signs that there's some work to do with constipation.
Interesting. Very interesting. Thank you. So you had said constipation is an increasing problem in our society because of food choices, because of what's in our food, because of how we're eating.
Yeah,
because we're sneaking those Oreos.
Exactly. I think it's relatively low fiber diets that we've had, where we used to have more fiber in our diets, and then also the nature of our work is I think we tend to be more sedentary. We're not out, moving a lot and doing, as much exercise maybe as we should.
How much fiber do we need? Do we need a lot of fiber?
I think most experts would probably suggest 20 to 30 grams total of fiber daily is probably what our goal should be.
And if people don't get enough fiber in their diets, should they take fiber supplements, or are those a bad thing too?
Yeah, fiber supplements are perfectly, safe to take. There's several out there that come in generic and brand forms, and you can certainly try it and see how you feel. Sometimes fiber can make you feel a little bit bloated, so you just kind of have to see your body. But there are different types of fiber out there, and oftentimes, there really isn't any downside to trying some.
So I have asked you, and you have been very patient with all of my questions, from poo to polyps and everything in between. Is there anything that you wanted to make certain the public knows, or, let them know how to get in touch with you folks at Borland Groover?
Yeah, I appreciate you being so thorough with your questions. I think we covered a lot of ground here. I would say my main takeaway points at this point is that if you're age 45, you should definitely think about colon cancer screening and go see your doctor and discuss that if you haven't already. If you think you may be at increased risk, have a discussion. Don't put these things off. You wouldn't put off, regular maintenance on your normal everyday things such as cars and things. Don't put it off on your body, which is the most important. So definitely have those important discussions, whether it's colon cancer screening or any other types of health conditions. See your doctors and discuss those. And any screening is better than no screening as well. Just make sure that you're choosing the right one for you and having those discussions. Feel free to go ahead and call us at Borland Groover to make an appointment or schedule your colonoscopy or see how we can help you. Our phone number is area code 904-398-7205.
And we will put that information as well as this interview on our website at WOKV.com. Chase Bunker is working on that. It will be up sometime later today. Dr. Ishaan Madhok, Borland Groover, thank you so much for your candid answers to our questions today.
Sure. Thank you for having me.